It's Abigail Noble back with episode 4 of Take Back Your Pharma, Getting Smart with Pharma. I am following up on episode 3, which was about the federal and state bureaucratic barriers to patients getting pain medication. Today is about one that we haven't talked about yet, and that is limiting who may prescribe. Nurse practitioners can do many things that they are educated and trained to do, but they have been limited in Michigan from writing prescriptions for pain medications. Interestingly, last week, today is May 5, on April 30, a last minute bill was added to the House Health Policy Committee agenda in Lansing, and it would expand the nurse practitioner scope of practice to include both prescribing Schedule 2 to 5 controlled substances, which would include pain medications, and be able to dispense the starter packs, the complementary starter packs of those controlled substances. I found this very interesting because if there aren't enough physicians prescribing pain medications, and there aren't in Michigan, there are many chronic pain patients who have difficulty finding a physician to prescribe medications for them. Expanding that ability to nurse practitioners would increase access to pain medications for these patients. So I'm going to show you the bill. I thought it was an interesting one, and it makes a good sorry, it takes me a second to share here. It take the there we go. I'm going to take you to the Michigan Healthcare Freedom Community Forum, where this is posted about the April 30 edition. This is House Bill 4399, and I put an analysis here about what the various pages do in this bill. I'm going to start with page 9 with the new prescribing privileges, and pages 10 through 11 would give them independent privileges for dispensing the starter packs. Until now, they have had to have physicians co-sign these orders, or they may only do so at the delegation of the physician, and the order, the prescription that goes to the pharmacy needs to include full information for both the nurse and the physician. It's incredible duplication of effort, and it adds to patient costs. So this is one of the cost drivers of healthcare when we have duplication like this. To say nothing of being rather insulting to the people who have gotten training and have the skills and the knowledge to be able to do this independently. So let's go over to the bill itself. This makes a good exercise in bill reading as well. So here we are on page 7, which includes a lengthy description of nurse practitioners' duties. And we'll come back to that. This bold text is what's inserted and added to the law. The standard looking font here is what's existing in law. And of course, the cross out is the parts that they're removing. So you can kind of see how the bill making process looks. So here we are on page 9. An advanced practice registered nurse who holds a specialty certification in the specialty field of nurse practitioner may prescribe a controlled substance included in schedules 2 to 5. And the rest is description of what that would look like and how that would be done. So that is all bold text, and that's inserted. Couple of modifications, removing the duplicate part with this added. And then go down to page 10, and section 4 is the new part that's added, that they may order, receive, and dispense complementary starter doses of controlled substances. So same type of drug, different format. It's either prescribing or handing out. Then I want to also mention one of my concerns about this bill is that the new list of the criteria that nurse practitioners have to meet in order to get this specialty certification from the Michigan Licensing Board. These all sound reasonable. They've completed graduate, postgraduate, or doctoral level nursing education program. My concern is that the insertion here that the board determines prepares them for the field. Right now, the existing law has it spelled out what certifications they have to have in order to qualify. This opens the door for the board adding more criteria and therefore having a tighter hold on nurse practitioners in this state. That concerns me a bit. As well as the section C, they must meet any other requirement established by the board by rule. And yes, there's a rulemaking process that they have to go through to start new rules, but that opens the door again to them doing so. The rest of this looks fairly standard. And I also wanted to show you in the, this is the home page for this bill, House Bill 4399 of 2025. You can see here the sponsors, the section of law that it would be modifying. Under documents here, the House introduced bill, that's as far as it has gone. And this PDF button here off on the left, that's the one I was just showing you of the text of the bill itself. There's also the House Fiscal Agency analysis. And I've pulled that up here. And you can see they spell out for you what the current requirements are. Here are the national organizations that can provide the different credentials for nurse practitioners. And here are the roles that they can perform. And then it tells you under the bill the changes that have been made. So these analyses provide a nice summary of what was law and what would be law if this bill were to pass. It's always a good idea to read the bill for yourself and then read the analysis. Nobody catches everything the first time through, and it's good to have a fail-safe on that. So that's what I'm seeing. The interesting thing as well is that that was the first hearing of the bill. Bills typically get 2 hearings in committee. So we're looking back at last week's post about the agenda and the meeting last week. It is on the agenda for this week, Wednesday, as well, which will be May 7. So I recommend nurse practitioners, if you know any, go ahead and let them know. And nurse practitioners especially should watch and consider contacting your state representative about this bill, because invariably, if you're going to expand nurse practitioners' ability to work, you are going to get the physician lobbies opposing it strenuously and talking about how dangerous it is for nurses to operate without physician oversight. Well, these are nurse practitioners. Again, they're fully educated on all of this. And it would increase access for patients who need care. So think about it. Consider contacting your legislators and be prepared for some very extreme accusations from the physician lobbies on this bill. You'll get some fireworks in these hearings. And that's all I have for today. I'll post these links in the comments, and I hope you will comment with your opinions as well. Thanks for listening, and have a great evening.